Our topic today will be to provide some information about natural treatments for the prostate gland, which is considered the second heart of a man. We will show in detail about chronic prostatitis based on traditional medicine. Hello, dear friends, subscribe to the channel and write your thoughts. The prostate gland is an organ the size of a chestnut. It is located under the bladder. If a patient has a problem with the prostate, this initially leads to psychological, spiritual, and depressive disorders. One of the complaints of some patients is inflammation of the prostate, enlargement of the prostate, hyperplasia. In other words, prostate enlargement is also a problem. Watch the video until the end. We will talk about prostate diseases. Throughout a person's life, the prostate gland works hard to perform various functions. Collecting urine in the bladder until it is completely filled and does not flow out on its own. Providing urine. Also during ejaculation, the removal of prostate juice and sperm in general is a direct work of the prostate muscles. The urethra passes through the center of the prostate gland. If we compare the prostate gland to an apple, we should think of the urethra as the core of the apple. Urine is a highly toxic substance. It is known that if a person's hand stays in urine for a day, a wound will form on his skin. All these factors do not affect prostate tissue. Regarding the prostate, there is even an opinion that there is no such thing as a completely healthy prostate. There is a prostate that is not fully examined. Therefore, calcified and fibrous changes detected during prostate examination are not always a sign of prostate disease. Additionally, any hard tissue found in the prostate is not a prostate stone. So, prostatic hyperplasia is an enlargement of the prostate and the formation of nodules around the prostate. Inflammation of the prostate itself may also occur. At the same time, sometimes the prostate does not grow, but patients suffer from pain in the prostate area, let's say, from a violation of comfort. This is called prostatitis, that is, inflammation of the prostate gland. There is also an accumulation of calcifications around the prostate gland, which does not allow the prostate gland to be supplied with a large amount of blood and nutrition. It is necessary to prevent the proliferation of these calcifications. First of all, let's start with the formation of calcifications in the prostate. What are calcifications? Calcifications form in those people who move little and sit a lot. For example, office workers, employees, officials, etc. In such people, first of all, calcifications accumulate more in the prostate area. My first advice to these people is to walk for an hour a day. If the prostate gland has not grown, you can ride a horse or bike. But if hyperplasia has occurred in the prostate gland, if it has grown, neither riding a horse nor riding a bicycle is strictly prohibited. But you can walk. What is my second recommendation to these people? My advice to people who suffer from both prostatitis, prostatic growth and hyperplasia, and prostate calcification, let them walk 10 minutes a day. You know the goose walk. I'll explain how it happens. He puts his hand on a branch of the neck, then crouches and begins to walk in a squat. It is better to take such a walk for 10 minutes in the morning and 10 minutes in the evening. This walk is extremely beneficial for the prostate gland. If you have prostate problems, you should definitely do this. What are we gaining here? With such a walk, we work out the prostate gland well, we work it intensively. By working and improving the blood supply to the prostate, we can treat many prostate diseases in this way. That is, this is our recommendation for people who are initially struggling with the disease. Walking for an hour a day, goose walking, is our initial recommendation. Then we begin treatment. If there is prostatic hyperplasia, i.e. if it is enlarged, a PSA test must be taken as a preliminary examination. What is PSA? Measuring the level of prostate-specific antigen, which we call PSA for short, in the blood allows us to detect prostate cancer at an earlier stage. In other words, PSA is a tumor marker used to determine the growth pattern of the prostate. That is, an increase in PSA levels in the blood makes one think that the patient may have prostate cancer. Sometimes the growth of the prostate gland can be a consequence of a malignant tumor. Or it may be due to benign tumors. When it is due to benign tumors, PSA increases less. For example, if the norm is 2.5, then you can increase it to 4 or 5. Sometimes, when it increases to 4 to 5, most patients experience stress and mistakenly think that it is a malignant tumor. A benign tumor can reach 4 or 5. But a malignant number can reach 15, 20, 100 or even 200. That is, it is necessary to analyze PSA in the initial situation. Once the prostate disease is identified, treatment begins. With an enlarged prostate gland, the patient urinates more often at night. For example, there are patients who urinate 10 times a night. Imagine that you urinate 10 times at night, which means that this person does not sleep at night. If he does not sleep at night, he suffers, is nervous in the morning, sleepy all day. Why do you urinate more at night? Because prostatic hyperplasia is growing. The prostate gland sometimes increases in volume up to 100 cubic meters. Normally it should be up to 25 cubic meters. The prostate is located at the bottom of the bladder, and its excessive growth protrudes into the bladder, and is not located at the bottom of the bladder, but on the sides, and this prevents complete emptying of the bladder when the patient is sick. Urinates. Urine remains in the bladder, and if it remains, the more that remains, the less sleep the patient will have at night, that is, he will urinate more often. This continues, after a certain time, as soon as a little urine accumulates. The desire to go out again at night appears, and the person suffers greatly. In addition, the amount of enzymes called prostaglandins increases in the blood of people who are more likely to suffer from prostate hyperplasia. What this means is that by reproducing, you find peace in a person, you have no desires, not even sexual desire. Complaints may vary depending on the age of the patient and the location of the calcification. Difficulty urinating, pain during urination and at the end of urination, chronic pain in the pelvis, perineum, groin, false sensation of urine when the bladder is empty, false urge to urinate, pain during ejaculation, sometimes pain and discomfort in these areas. During normal quiet walking may be associated with calcifications and prostate stones. During these pains, you can transfer the pain to the scrotum and feel it there. Some patients experience unbearably severe pain in the perineum during and after urination. In addition, the presence of blood in semen during urination and especially during ejaculation is also a common symptom. The presence of blood in semen is due to the fact that prostate stones damage healthy tissue as a result of contraction of the prostate muscles, displacing prostate juice during ejaculation. Black cumin is one of the most effective treatments for prostate hyperplasia and elevated PSA. Sometimes it is called black bread weed. Firstly, cumin has a good effect on itself, and secondly, its oil has a good effect. If the prostate gland is very large, say about 100 cubic meters, you buy 1 kilogram of cumin seeds. Waking up in the morning, take 3 teaspoons and pour the seeds into a coffee grinder. After rinsing, place a teaspoon in your mouth and drink a glass of water on top. Pour the remaining 2 teaspoons into a container and cover with a lid so that air does not get into it and it does not oxidize. Take it once a day before dinner and wash it down with water. It has a very good effect. It reduces the size of an enlarged prostate gland, makes urination easier, and reduces elevated PSA levels. There are patients who are prescribed black cumin, but it has a weak effect. Sometimes it gives an excellent effect. When it shows little effect, we already expand our treatment method even more. In our other videos, we will show more extensive treatment methods. When preparing the video, quotes were taken from the opinions of many healthcare specialists in Azerbaijan. Bye for now.